the problem. You can see the discontinuity along with some hematomas. Another longitudinal view at the level of the joint, and you can see due to trauma there is hematoma formation. Then we come to lateral pain, the pain on the lateral side of the ankle. We evaluate the peroneal tendons, peroneus longus and brevis and retinacula. Actually, peroneus longus and brevis are less involved as compared to the retinacula and the deltoid ligament. In most of the cases you will get retinacula or the deltoid ligament which is involved, and it takes 6 to 8 months to get relieved, even if there is a small amount of inflammation of that retinacula, depending upon the age and mobility of that joint. Lateral collateral ligament complex is to be evaluated and anterior joint for an effusion. For peroneal tendons, you can have a longitudinal view of the peroneus longus and peroneus brevis. This is a view which can be taken just below the lateral malleolus for longus and brevis transversely, and you can move the foot of the patient to evaluate the longus and brevis for subluxation of the peroneal tendons. Along with subluxation you can have tears. This is inflammation. You can have tear of the peroneal tendons depending upon the injury, and this hypoequic area is the torn deltoid ligament. Then coming to anterior talofibular ligament tears, here is the normal. You can see the normal anterior talofibular ligament. This much is the talofibular ligament, and acute tear in which you get discontinuity in this structure. In this case you are not getting it. It is discontinued at this area. So this area can be seen, whereas it is absent near to the fibula. In a chronic case it will be different. This is the normal structure and here it is absent, and you are getting signs of calcification are appearing. In calcaneofibular ligament, here is the normal calcaneofibular ligament. You can measure it. In normals it is just 1.2 millimeters in its width. There is a chronic tear, acute tear here. You can see the discontinuity, and a large tear, whole of the ligament is absent. When we come to posterior ankle assessment, if there is pain in the ankle joint at the posterior, we evaluate the Achilles tendon and for retrocalcaneal bursa. We can have partial tears, we can see longitudinally and transversely. All of this is the transverse section of the tendo-Achilles, and this area is hypoequic as compared to the normal echotexture of tendon, which means that almost 1/3 of the tendon is involved and there is a tear, which is partial tear. There is full thickness tear. You can see the two ends and discontinuity, and a chronic case in which there was tear and now there are calcifications. These are few areas at which you have got calcifications. Then comes medial ankle assessment. We look for medial pain, for medial tendons, medial collateral ligament and joint for effusion. We look for the normal medial tendons, especially for flexor hallucis longus. We can look for tibialis posterior, and this is flexor digitorum longus. So all the tendons, they appear similar on ultrasound. It depends upon your surface area and your surface anatomy where you are putting your probe. This is tibialis posterior tendon, and you can see the split, acute case. Then a patient can come to you with heel pain. This is the plantar pain, and usually the cause is fasciitis, the inflammation of the fascia, This is normal fascia, and you can compare the abnormal one which is inflamed. Few cases of plantar fascia fibromas, you can get fibromas, it is more clear in this scan, and you can get plantar fascia hemangiomas. Here is again hemangioma. So along with the hemangiomas you can see the vessel which is lying near to it. Coming to foot pathologies, we can have traumas, foreign bodies, ganglion infection, fractures, and implantation dermide. And we can have Morton's neuroma or GCT. Here is serpiginous dorsal ganglion. You can confirm it by changing your probes angle so that you are not making wrong diagnosis by having some hypoequic area. Fusion following trauma is very important. This is anterior longitudinally, the anterior longitudinally for the chronic swelling in hemophilic patient. I know all these things are boring and you need coffee. So don't be like this. We have ended the talk. Thank you very much.